Hi guys, welcome back to the channel. It's your girl Victoria. How y'all doing? Thank you so much for those that are returning. Thank you so much for your support. And if this is your first time coming to this channel, my name is Victoria Iwuji. I'm a registered nurse. In this channel, I talk about nursing, beauty, and nutrition. So in today's video, without wasting much of your time, as you can see on the title below, the title of this video is Emergency versus Urgent Care. Okay? Emergency versus urgent care. As we all know, when something is emergency, it means that it requires emergency response, okay, versus when it's urgency. And I'm going to explain to you. So emergency are known as situations that are life-threatening. Like if nothing is done right away to save you, you're probably going to die out of it. So those are like emergency situations. And here in the United States, I'm 100% sure that emergency rooms function 24 hours a day, okay, 7 days a week, from January 1st until December 31st, the whole year round the clock, emergency rooms are functioning. So if at any point in time that you have emergency situations, you're sure your instinct is telling you that you need help, please, it is important that you go to emergency and get the help that you need. Emergency rooms or ER are equipped to provide and offer medical services to people 24/7. So if you need it, please do not hesitate to go. And they provide services ranging from motor vehicle accidents, gunshot, traumatic events that people face in every day of their life. So if anything like traumatic happen and you really need a care, this is the time to go to emergency and you get the help that you need, okay? While on the other hand, urgent care centers are designed to fill in the gap. Okay, they are designed to fill in the gap in case of you have minor cuts, like a little cut and you just need a treatment, you can walk into urgent care for it. So urgent care are for like situations that are not life-threatening. When something is life-threatening, it's something like a do or die situation. Like in Nigeria, we say do or die. So when something is do or die situation, that's an emergency care. So when something is not life-threatening, is minor, is not major, then you can walk into urgent care clinics, because urgent care clinics are designed in a way that they can fit in that gap that you and provide the help that you need in case your primary care provider is not available or is off office hours, or even though you don't even have a primary care provider. So you can always walk into urgent care clinics and get the help that you need. Today's videos, I will share with you guys certain conditions that require you to go to the emergency room and certain conditions that also require that you go into urgent care services. So stay tuned. If you are having chest pain or difficulty breathing, that's an emergency situation. When you have motor vehicle accidents, this is an emergency situation. When you have deep cuts, like a very big cut that needs sutures or they need stitches, this is an emergency situation. When you have seizures, this is an emergency situation. You need to go to the emergency and take care of yourself. If you have toddler or little kids that fall, and after they fall, 2 to 3 days, between 24 to 72 hours of the fall, and your child starts to vomit, this is a medical emergency. Do you know why? Because this child might be having concussion from the fall. So there might be some head injury. It's an emergency situation. This is not where you're going to take them to the primary care provider. No, take the child straight to the emergency. Some examinations need to be done to be able to rule out internal bleeding and other head injuries. Okay? That's an emergency situation. If you fall and have a broken bone, it's obvious that the bone is broken, you can't walk or you can't move your hand, that's an emergency situation. If you're pregnant and you start having vaginal bleeding during pregnancy is an emergency situation, so you need to visit the emergency room. Fainting or change in status, mental status. Someone just passed out or they faint. Okay? If you're close to them, please, that's an emergency situation. Call 911 if you don't have access. If it's not your family member and you cannot drive them, call 911, okay? That's an emergency situation. If while having conversation with someone that you know too well that they are okay, and all of a sudden there's change in mental status, and you start asking them normal question and during conversation and you see that their conversation is off, okay? Change in mental state is an emergency situation. You need to take them to the emergency room. If someone starts having slurred speech is when someone moves from speaking normally to slurred, like they can't speak normal anymore. That could be a sign of transient ischemic attack. Transient ischemic attack is a warning sign that stroke is coming. TIA, transient ischemic attack. And slurred speech is one of the signs of this stroke. Okay, so when someone is having slurred speech, it means that the muscle, the vocal cord is weakening. Okay, they have muscle weakness on the vocal cord. Is an emergency situation. You need to call so that they can go to the hospital. Transient ischemic stroke is a warning sign of a pending stroke or a future stroke. So you really need to visit the emergency so that these things can be ruled out. In case you are by yourself and you have a sign and you have like your instinct is telling you that whatever is going on with you at the moment, you really need to go to the emergency, there are things to consider. If you drive and you have and you feeling dizzy, you're tired, you're having seizure, please do not drive. Call 911. It's really important to call 911. You know why? Then as the paramedics arrive, they always start life-saving treatment right there in the ambulance while driving you to the hospital. And as soon as you get to the hospital in an ambulance, your care is prioritized. So they're gonna prioritize your care, take care of you, know what's going on, and stabilize you. If you need to stay inpatient, then they're gonna transfer you to inpatient care. And if you don't need inpatient treatment, they're gonna stabilize you, see that you're okay, and you're gonna be discharged, okay? When your instinct is telling you call 911, please do not hesitate to call 911. At least in the United States, when you call 911, ambulance comes and take care of you for medical treatment. And where I come from, my country, Nigeria, if you are close to someone, our neighbors are always our 911. So if you are in good relationship with your neighbor and something is going on, please shout out to your neighbors. Call somebody to take you to the hospital, okay? Please do not die in silence. It's better to be safe than sorry. While all of these above that I mentioned are the situation where you can go to an emergency room, I'm going to share with you the minor situations that you can go to the urgent care for. So in case of fever without a rash, okay? Fever without a rash, you can go to the urgent care. Small minor cut, small, not deep, not a cut that needs stitches. If it's something that doesn't need stitches, you don't need stitches, yes, you can go to the urgent care. If you're coughing, you have sore throat, yes, you can go to the urgent care center. If you're having shortness of breath, you can go to the urgent center because urgent centers are equipped with oxygen tanks and nasal cannulas, so they can always put you on oxygen while they watch you. And if your situation starts to get worse, they will keep you there and call 911 and transfer you to the emergency room, okay? So with shortness of breath, yes, you can go to urgent care. Persistent diarrhea, you can go to urgent care for that. Vomiting, yes, you can go to urgent care. This vomiting is different from the vomiting that I mentioned when a child falls and 24 to 72 hours and the child starts to vomit. With that of a child, please go to the emergency room, not urgent care. And okay, anything going on with the kids, if it's minor things, I schedule an appointment and I take them to the healthcare provider. Okay, thank God, I haven't had a situation that I had to go to the urgent care with them. And if I have to, of course, I will take them to there. Okay, so flu-like symptoms. So any flu-like symptoms, you can go to urgent care for that. Okay, it's really important that before you go to urgent care, you try to call your primary care provider. Your primary care provider is the doctor name that is on your insurance card. If you have insurance, when you look at your insurance, you're gonna see your primary care provider, say PCP, and they have your doctor's name written on that card. So that is your primary care provider. Before you go to urgent care, it's important that you call your primary care provider, see if they have opening for that moment. If you can walk in, ask them before you call urgent care. And the reason why you need to call your primary care provider first is to see if you can get same-day service. And also, your primary care provider is already familiar with your health history, okay? They might know other health conditions that they might consider before commencing treatment. So it's really important that you see them prior to going to urgent care. So if you check and they're not available or it's off office hours, it's good for you to go to the urgent care. This is what I want to share with you guys today. I think it's important for people to know when to go to the urgent care and when to go to the emergency care, okay? It's really important. If you're dying, you feel like you cannot breathe at all, go to emergency care, okay? If you wake up and you're having some irritation of the throat is when sometimes you have the feeling of itching your throat with your tongue, and you're doing that, okay? You can go to urgent care, all right? Thank you so much for watching. Thank you so much for your support. Please share this video, support me. If you haven't subscribed already, hey, what are you waiting for? Please go ahead and hit on the subscribe button and share, like my video to support me. Thank you, thank you, thank you. And I will see you very, very soon, okay? I promise. It's not going to be long this time. I'm going to see you all soon.